Hey, this is Dr. Tom Rogers at Performance Medicine. I hope you guys had a really good 4th of July weekend. I sure did. I always loved 4th of July. It was my dad's birthday, so he would have been 98 on this July 4th, so remembering him a lot. And gosh, what great weather we had. Nice and cool for July. So I hope you guys are out there having a great time. It's the best time of the year, in my opinion, at least in East Tennessee it is. We're all picnicking and all that, and we're eating a lot of fruits. So I decided to talk about fruits today. There's a lot of misconceptions about fruits. Fruits can be healthy, but they can also be misleading. And I'm going to clear up some of those misconceptions and tell you which fruits that you need to be eating and which ones to really avoid some of. It's kind of misconception because fruit is sugar. Now, you got to look at that glycemic index. So some fruits are way more sugary than other fruits. And the kind of sugar that's in fruits is called fructose. And it's actually worse than glucose because, for one thing, when you eat fruit, you really never get full. Did you ever notice that? So really fructose, it's kind of hard on your liver. It doesn't act like glucose. And it sure doesn't fill you up. So you can eat way too much of it and get way too much sugar in there, which will raise your blood sugar. So you have to be picky about which fruits you eat. So the best, of course, are the berries. I tell this to my patients every day. There's no berry that's really bad for you, from blueberries, which is my favorite, to raspberries, strawberries, cherries. So if it's a berry, it's generally very packed with, it's nutrient dense, it's low calorie, and it's low in sugar. Now I'm going to surprise you here because there's two really kind of bad fruits for you. My all-time worst fruit is bananas. It's actually, bananas are the most commonly eaten fruits in the world. But they're really high in sugar. They really screw with your hormones as well. But bananas, one banana, if you eat one banana, that's as much sugar as you need to eat in a whole day. It goes straight to your bloodstream. So bananas are my worst one. And another everyday, and the other thing about sometimes bananas, a lot of people are allergic to bananas. I myself, every time I eat a banana, my mouth gets kind of tingly and sour. It's when I do my food allergy testing, bananas is one that comes up that's risky for me. So I certainly avoid bananas. For athletes, it may be okay if you're competing because it is quick energy, but for most people, they don't need to be eating bananas. The other one that I want to talk about, you remember the old saying, an apple a day keeps the doctor away? Well, it turns out that apples are really maybe even worse than bananas for you. They are definitely the last in terms of nutrient density. And by that I mean the nutrient density. I'm talking about the amount of fiber, minerals, and vitamins that are in a food. And it turns out that apples are even worse than bananas. Same as bananas, one apple a day contains the amount of sugar you want to consume for the whole day. So instead of an apple a day, why don't you change it to an apple a week? Now, bananas and apples both have fiber in them, which is good. And apples actually have more fiber than bananas in them. But you can get your fibers and vitamins and nutrients really by eating more things like greens and spinach and broccoli. They have a lot more nutrients packed into them than the bananas or apples by far. The last one that I really is on my bad list is fruit juices. Fruit juices are, number one, they're stripped of all the fiber in them altogether, so you're just drinking down sugar. So fruit juices, which are really more consumed than fruits are really bad for you. Just guzzle a bunch of sugar if that's what you want to do. So it's really Fructose is, again, it's a lot worse than glucose, which is the main form of sugar that we talk about. And it really leads to overeating, and it's very bad for your liver as well. So don't consume a lot of these things. Be very picky about it. And again, life is not fair. Some people can eat more of them than others. But fruits are, the other thing about fruits is they're meant to be eaten seasonally. With our ancestors, they picked their own and they foraged for them. But, now they're in the grocery every day of the year. And they also have a lot of stuff that's on them and pesticides and things. So if you do eat the fruits you eat, they're usually very thin skin, unless it's a banana, which you don't want to be eating anyway. But get organic. The thinner the skin on these things, fruits or vegetables, the more you need to be eating organic. Makes a whole lot of difference, and it's not that much more expensive. Of course, if you want to get a good amount of nutrition, nutrient-dense foods, think about vegetables. They are very nutrient-dense, and they don't have a lot of sugar in them. So, and there's a lot of controversy about other nutrient-dense foods like eggs and cheese are very nutrient dense. And if you can tolerate them and aren't allergic to eggs or dairy, then they are very nutrient dense. And this whole myth about saturated fat has been blown by the wayside. Saturated fats do not cause heart disease. That's something that most people should know by now, but a lot of people, most doctors don't even know that. So you have to look at the nutrient dense thing. Like vegetables, seafood, very nutrient dense. So my preference is seafood and vegetables as a baseline of your diet. You need to really avoid grains and legumes too, for a lot of reasons. They're allergenic, they have a lot of pesticides, a lot of hormones a lot of times. And again, they're not nutrient dense. They've been stripped of almost all the nutrients in them nowadays. So it kind of goes against what you may have heard. Spinach and kale, of course, are good. So you need to maximize that nutrient density. This will manage your insulin levels, which is very important, which really, I think, is the key to your health and certainly your weight, are your insulin levels. It's not your fat levels, it's your insulin levels. Remember, sugar causes metabolic syndrome, which we usually talk about being high blood pressure, high cholesterol, and diabetes, or at least insulin resistance, and metabolic syndrome leads to heart disease and cancer. So think about that. That's why if you develop cancer, one of the first things you should do is thinking about going keto. And again, the average person doesn't need to go keto. They need to do intermittent fasting, which puts you in a mild state of ketosis, meaning you're burning your own fat, which gives you more energy. Your brain will think better. So think about intermittent fasting. I plug that all the time. I'm big on it. And so I hope this helps you. So fruits can be good, but avoid those high glycemic fruits. I hope what I've just told you will lead you to cut down on at least your bananas and your apple consumption. And next week, we're going to be doing something really fun. I'm going to apply a continuous glucose monitor to my arm over here. I'll work with Andy on this. And for a couple weeks, I'm going to measure everything that I eat and see what it does to my blood sugar. And so we'll do this over probably about a 2-week thing so that I can report to you what the different foods did to my blood sugars. I think almost everybody should do this on themselves, not just type 1 diabetics. So I think that'll be a kind of a fun experiment to do, and I hope it proves a point. It'll give me a lot of knowledge. I've never done this on myself. Of course, my 2 diabetic kids do. But I think the average person needs to know what kind of foods are going to bounce those sugars up. Your hemoglobin A1C, which is a 3-month measure of your average sugars, don't tell the whole story. It's really done by continuous glucose monitoring, because when you spike that sugar level, it's nicking your arteries. It's causing damage to your cardiovascular system. It's leading to all kinds of problems, not just heart disease and cancer, but also dementia, Alzheimer's type. So I hope this will be a fun type experiment that we can do, and any knowledge that I gain, I'm going to tell you about. I wouldn't do anything on a patient I wouldn't do on myself. So this is Dr. Tom Rogers at Performance Medicine. I hope you can eat more berries and less apples and bananas, and monitor your sugar levels. Very, very important for your overall health. I'll see you next week.